Hello everyone, welcome to sqadia.com, and now in our final section we will talk about some borderline epithelial tumor. In this we will talk about the characteristics of some borderline epithelial tumor, treatment of borderline epithelial tumor, and para-ovarian cyst and its removal. The characteristics of borderline epithelial tumor of the ovary is borderline. Since it's called the borderline, it's in the middle in position between the benign and malignant. So it's intermediate in between the benign and malignant ovarian tumor. There is formation of microscopic papillary projection. If we see this microscopic, these are the papillary projection on microscopic examination, papilla formation. There is stratification of epithelial cells. As a result of metaplastic changes, there is stratification of epithelial cells. There is epithelial cell pleomorphism. Pleomorphism is different types of cells present, or different types of features or present in the epithelial cells is pleomorphism. Then there is presence of papillary projection on external surface also. There is detachment of cellular clusters. So these are some important characteristics of borderline epithelial tumor, in which there is mainly papillary projections present. There is pleomorphism of the epithelial cells, and there is stratification of the epithelial cells. Also, there is increased cellular mitotic activity. There is increased reproduction or growth of the cells. That leads to the development of the abnormal growths or the tumor. Then there is atypia. Again, atypia is the feature of the growth of the abnormal cells. When there is increase in the cell growth that leads to tumors or cancers, there is atypia present, because atypical type of cells are produced or formed in the tumors. Treatment of epithelial borderline tumor is usually unilateral oophorectomy. Oophorectomy is the removal of the ovary. It's on one side. Then we have total hysterectomy with bilateral salpingio-oophorectomy. So two treatment options. One is oophorectomy, unilateral, or it can be total hysterectomy. Again, unilateral oophorectomy is preferred in the reproductive age of the patient, because if one ovary is saved or protected, there are chances of conception and pregnancy. This is the picture of the ovary, fallopian tube, corpus luteum. This is the mature follicle. This is the ovum. This is the developing follicle. All these are the features of the normal. So in unilateral oophorectomy, only the ovary is removed, and in only the ovary is removed. But in total hysterectomy with bilateral salpingio-oophorectomy, the entire this structure are removed. Then para-ovarian cyst. Para-ovarian cyst is arise from vestigial remnant of Wolffian in the mesosalpinx, or from the peritoneal inclusion, or from tubal epithelium. Para-ovarian cyst. Para is the surrounding area ovarian cyst. This is the picture of para-ovarian cyst, and different, it arises as vestigial remnant. Vestigial is embryonic remnant that doesn't disappear or regress, and it arises from the vestigial remnant of Wolffian duct in the mesosalpinx, or from peritoneal inclusion or tubal epithelium. So three main sources from this, from where this para-ovarian cyst develop. Then the removal of the tumor, surgical removal of the a cyst. This is the cyst present, and incision is given here in the cyst, and then cyst is taken out of the cut, and then the pedicle of the cyst is removed and cut, and then in the last stage there is a closure of the incision done. So this is the cystectomy done. Cyst is removed along with the pedicle. Incision is given, cyst is removed, and then the pedicle of the cyst is removed, and then finally there is closure of the cut or the incision. So this was all about the borderline tumor of the ovary, which is in between benign and malignant. Then we talked about the characteristics of borderline, what are the different types and how they are treated or removed. So thank you for watching sqadia.com.